Here in North East Lincolnshire, we were fortunate enough to be part of the Delivering Better Value in SEND Department for Education programme, which gives us £1 million of grant funding to support a more sustainable SEND system across our borough. Recently, we launched our programme behind me at the Town Hall. Here's what some of our attendees had to say.
So I've started as a new SENCO from Easter at our school, which has got quite a lot of high needs. What I found invaluable is the support from the SEN service, and just for the fact that I can contact other SENCOs and other schools, and also contacting some of the local authority and looking on their local offer. I also think I just need a little bit more understanding about the funding, really, and helping us with what the next processes are. As a new SENCO, some more support is definitely needed and extra training.
In my personal experience, the nursery provision for SEN children in the area is really good. The nursery that my son attends have been fantastic, and it's a really good starting point for him then to move on to obviously primary school and onwards from there. The negative, I think, I know that our waiting times are better than other local authorities, but they're still really not good enough. The EHCP process, as an example, the diagnostic process for autism, it's too lengthy. My son's EHCP isn't going to be in place for him to start primary school, which then causes further problems for us in fighting for a specialist provision for him.
From my perspective of what's going well, I recently moved from an academy trust where a lot of training was in-house, so I've been really pleasantly surprised by the volume of training available for SENCOs and provision around SEND in terms of the relational approach, and lots of different things I wasn't aware of was available in my previous role. What I think could be improved, capacity. The access pathway, for example, having a 72-week wait is very frustrating. It's hard when you've got to pay for all the commission services within a budget to be able to get as much support as you would like for the pupils' needs. And just ultimately, there are so many pupils coming in with high needs. It's making sure we meet their needs as much as possible with a very tight budget, even when you do get those EHCPs approved.
From an SEN perspective, I think one of the best things that we've got is the multi-agency working, in particular across health and with council colleagues, but also linking in with other agencies as well. In terms of things that need to be improved, probably partnership working. There's always more that you can do, but also I think some of the more specialist provision and our ability to think outside of the box and come up with innovative solutions for young people.
Okay, so from a SEN perspective, the good things that are happening within the area are the teams that are available to support and those support networks that we have in place. I do believe that in terms of a change that we need to recognise the needs of learners earlier on so we can provide that vital support and make sure that it follows them through the school years.
One thing that I think's been going well this year is the specialist advisory teachers have written a graduated response for children with special educational needs, for cognition and learning, and for social, emotional and mental health. And these graduated response toolkits have been rolled out to all schools in the authority, and they've been very well received. One thing I think that maybe could be improved and is the message I get from SENCOs a lot of the time are the long waiting lists for an access pathway referral and education, health and care plans, as well as CDC assessments as well for children in the early years. I think SENCOs can be quite frustrated with the length of time they have to wait for these plans to come to fruition.
Hi, I'm working very closely with the head of SEND and the designated clinical officer as part of my role as designated social care officer for all children with special educational needs and disabilities. And what I can see is the real commitment to improvements and to looking at where the gaps in services are and trying to fulfil some of those. I can see that everybody's got a real commitment to the children with special educational needs and disabilities in North East Lincolnshire to ensure that they've got the right support in place, to ensure that they're taking part in the right provisions and looking at alternatives should there not be something that's suitable more local. the only thing that I would be mindful of is that what we need to look at is bringing some of the more specialist provision locally, so that we're not having to resource and look for placements external and look outside of North East Lincolnshire, which can be quite costly to the authority. So to look at partners and to look at the stakeholders and see what can we do to bring that back in-house and to bring a bit more local specialist provision.
So one of the things I think that's gone well for SEND this year in our local authority is the amount of training that's been available for school staff and SENCOs. They've really responded to it really, really well, and we've had lots of positive feedback of what we've provided. And we're always offering new opportunities and tailoring that training to schools. And one thing I think that could be improved, if I'm only saying one thing, would be the communication perhaps between the local authority and schools. We have, as a local authority, we have a fantastic resource, which is a directory of services that's available in our local area, but that's not available to SENCOs in schools. So that's something that would be really useful for them. And just that communication of science, so that SENCOs know where they can signpost parents and their young people to for that additional support. That would be really useful.
What I think is positive about SEN provision locally is that there is a provision and that there is communication that's been building and developing and getting much better between multi-agencies. So I work in health visiting and we deal with a lot of the early years, but we're developing those networks and those relationships with schools, with settings, with nurseries, with the SEND teams, and even those opportunities to work in this more strategic level in developing some of the programmes moving forward. So I think that's really positive, that there's good engagement and a welcome to join in and to contribute to the future of SEND in North East Links. The aspect for me, I think that's maybe, well, we are developing and we've come a long way since I started, is the provision for identification of, in the early years, and the provision of services for those children that aren't yet in a setting or in a educational establishment. So I'm talking the babies through to 3-year-olds. So currently we are aware of the need to keep looking at what is the service provision, what knowledge and skills do we have in the local area, and how we can all work together to support families with these little children that are starting their journey on the SEND journey.
And I think what's been going well, particularly this year, I think it's moving towards these additional places in specialist settings, moving out to the 2 new schools and also Little Coats, what's happening there, with a view to turning the children back into mainstream education once they're ready. I think there's been a lot of thought go into that. It's well needed, and it's good to see that that's moving forward. For me as SENCO, I think what I feel is still a sticking point is the pathway for diagnoses for autism and ADHD. We get a lot of parents coming to us with healthcare professionals having said that school need to do a referral, and the process is so long and drawn out that that can be difficult, and it can be difficult when we don't have evidence in school to do those referrals. Gathering evidence is then a tricky thing to do, and I'm not sure, it's difficult sometimes to get the parents to understand the processes and that need to go ahead. And at the moment, obviously, the timescales are extremely long, and that's hard for parents when they are struggling with the children at home.
The SEN Service Support Manager is always there to help us at school whenever we have a child or a parent with needing support and we don't know where to go next. There is a higher level of need now in our schools. That need is increasing really quickly, and we're needing more and more support.